Hello, I'm Dr. Joseph Masci. I'm the chairman of the Department of Global Health at Elmhurst Hospital and professor of medicine and infectious diseases at the Icahn School of Medicine at Mount Sinai. COVID-19, of course, came as a very shocking surprise to the public hospitals in New York. It had begun in China in December of 2019. It had then arrived in Europe, particularly Italy, Spain, and France were hard hit. We were anticipating that we would see cases of it in the United States, but I think the magnitude of it came as a surprise to us. The sheer volume of patients with COVID-19 really required a reorganization of many healthcare systems in New York. New York was by far the hardest hit initially. And we saw many adjustments to accommodate these patients and their needs within the public hospital system, including at this hospital. COVID-19 is primarily a lung infection, but it only begins there. The patients who get sick with this often have not only respiratory problems, but they have unique combinations of other things. They can have a low blood pressure, for example, that we don't fully understand yet. They can have liver disease. They can have kidney disease. This was particularly common among our patients with severe COVID. They can develop clotting problems and have clots that travel throughout the body. This was also somewhat unexpected in these patients. So it is a complicated disorder that goes through several phases as we've begun to recognize. There is a phase where the virus is triggering a really massive immune response, and that accounts for a lot of the immediate problems that this infection brings with it in the severest cases. But then it goes into a later stage where the problems are the end organ diseases that it has then triggered. We, of course, have had many patients with HIV infection over the decades. We have one of the best HIV programs in the United States. HIV is also a complicated disease that brings along with it many unique features that had to be understood and treated. This infection came in a more explosive way, even than HIV did, to our hospital and to other hospitals that have now experienced this crushingly new infection. So it has some similarities to other things we've seen. It certainly has similarities to HIV, but it was unique in its volume and its complexity, I think, for anyone in the world, and including us. So it required a lot of flexibility on the part of our staff in trying to understand these problems and to anticipate them. Our ICU beds had to be expanded dramatically. We had help from doctors and nurses and other healthcare professionals from all over the country. We had members of all four arms of the military who volunteered to come here and help us take care of these patients. Most in need were emergency room doctors and intensive care unit doctors. And we thankfully had a huge population of really concerned professionals to draw upon for that.